So maybe we can like take 5-10 minutes to ask Dr. Fischetti to present what you are working on and like maybe share a little bit about the most interesting space problems that you encounter and like that excite you the most.
Yeah, yeah. And I'm so sorry I can't be there. I literally just got back from the ER. So I am an emergency medicine doctor. I work in the space medicine, the low resource setting division. We also kind of encompass wilderness medicine as well. It's a shared division between Mass General and Brigham. I am point of care ultrasound faculty, but within that space medicine division. And so specifically within my niche, what I look at is how do we come up with a way to basically enable the uses of the diagnostic equipment that's on the spaceship. So what happens right now is, these astronauts that go up, I mean, we're lucky if the flight surgeon is medically trained, whether it's a nurse, a doctor, a PA. But as commercialization continues to happen, you're going to have the layperson go up with the supplies and just, I mean, will it be enough to just give them the cue cards and like hope for telehealth? When you're talking about Leo, that will work, but when you're talking about a lunar base or going to Mars, those are real issues that could be really prohibitive for the layperson to navigate when deciding whether or not this is an emergency or not. And so part of my research has been how do we condense all of this medical knowledge and make it digestible for the layperson as quickly as possible, knowing that AI is not yet there in the software and the hardware of the ultrasound machines. There are companies now that have like features like cardiac ejection fraction. Some of them help with like needle guidance, et cetera. But I'll give you a perfect example. There's in the medical kits and in the medicines that are up in the ISS on these space flights, you only have so many medications for so long. You have to understand that the pharmacokinetics of like the metabolism also changes for astronauts in space. And so here's a perfect example. Let's say you do have an issue in space. Let's say someone breaks something or someone's sick, and you don't want to use something strong like a narcotic. You can do procedural guided anesthesia, meaning like nerve blocks and things like that, um, which can be a very difficult skill to do with ultrasound. But AI guided nerve blocks can be far easier to do, especially for a novice. And so you can imagine that if you're now applying regional anesthesia and not systemic anesthesia, so think about like morphine, whole body morphine versus localized like lidocaine, what that could do to impact crew safety and who that astronaut is and the role they play on that mission. And so there are downstream significant effects to making sure that we keep everybody safe. Inevitably something's going to happen in space. Physiology changes in space. Just so you guys know, some of the biggest issues that happen, as fluid shifts in gravity or low gravity, environments, fluid shifts up. And so more commonly you deal with like bladder retention, kidney stones, DVTs, but usually DVTs on Earth are lower in the lower legs. In space, they can be in the upper extremities. Um, Sometimes you'll have like localized skin infections, things like that. And then cerebral edema and kind of vision changes can happen as well. And so learning how to re-triage, how we decide what's an emergency, um, how does the physiology change and how can we help the bodies respond to that better are all important for making, space sustainable and for colonizing the moon and Mars. So that's just briefly a little bit about what I work on in the ultrasound sector, but my colleagues work on many other different things too. And so hopefully that helps a little bit.
Yeah, I'll just go seriously.
Yeah.
But
I have a question.
uh just so you can see me. Hello. So I just had a question about like if you had to like go across these three factors, which one's the hardest problem? Is it the difference of their metabolic and thing? You said that it's different when they're up in space and their metabolic pathways change. Is that the biggest deal? Is it just knowledge and awareness because they're in a limited environment of just knowing basic things like cold skincare and what the problem is? Or is it this game of like we can only have so much space for so many materials and supplies. So it's more about this game of figuring out what equipment we can send up that has the most generalized approach to solve as many problems, like get the right match of equipment and tools. What is like
I
your
mean,
1, 2, 3 priority
I
across
know
those?
it's so hard. It's so hard to, and I honestly think a lot of it, I love that you guys are doing this think tank too. A lot of it is also like thinking outside the box. And I'll give you an example. Um, Two things that really come to mind are acupuncture, right? Because space and mass are a really big deal, right? In the actual spaceship. And so, you know, even like the size of a pill, like every single thing is weighed, measured, like it takes up an important part of what goes onto that vessel. So think about acupuncture needles. Is acupuncture a way to treat pain in space? Um, I made the joke, I feel like Ozempic should be funding some of these studies because reducing mass, reducing waste, reducing food consumption is also very important too. I actually don't think that's that bad of an idea. But things like that where you're trying to think of, okay, like what other ways can we look at this problem and solve the fact that like we only have limited supplies, right? And the further you go, the less likely it is that you're going to be able to like resupply. Um, and so I would say currently, I think it depends where you're talking about. If you're talking about a lunar base or Mars, certainly it's the mass and an actual space ratio of like what can we take and how long does it last. For the ISS, like the resupply is a lot more feasible and realistic. Um, but again, part of it too will be how do you equip people? Because now we're going to have civilians going to space with less ideal physiologies. You used to have to be a perfect specimen. And how do you communicate to people that don't have basic, CPR, medical knowledge, whatever, knowing that they have only so much time to prepare? There's so many problems. It's so hard to tackle. But I would say if you're talking just from a physiology and like safety perspective, I think the biggest issue is how do we figure out what's an emergency and what's not? How do we do that quickly? And how do we decide, like, do we need to abort this mission? Do we need to like call for help? And then how do we decide which medications and things we need to use?
So you'd say identification is number one, then the game of what equipment and tools you bring up there too, and then just like the change in space environment's not that big of a deal. It's just like fundamental skin, whatever, like sicknesses, flus, colds, things like that.
Yeah,
Yeah.
and
Okay.
and even for something like ultrasound, for example, there are really good studies that show you can teach that to middle schoolers. You can teach it like, within a certain fundamental knowledge base, like to nurses. Like you don't have to be a board certified physician to be able to do that. Again, that gap will eventually hopefully be bridged by AI, but it's not there. And especially for ultrasound, it will take time because you need so much data to train these models on. And ultrasound is so nuanced in how you acquire the image, how the like every body habitus is different. So um, it can be really tricky to do that with.
Cool. The acupuncture comment was really interesting, by the way. Thank you.
They use it, and just so you know, they use it in the military. Like there's certain points within the ear, and they'll use it in like combat fields. But think about how small a needle is compared to like, I don't know, any other like sort of even the size of a pill. So thinking outside of the box is, I think, the way that we solve a lot of these issues too.
Thanks so much for sharing all this. I think it's very inspirational for us to see real scientists working right now on these problems.